It happened in the middle of the night. A man in his late 60s woke suddenly, a deep pulsing ache pounding inside his knee, almost like a heartbeat under the skin. At first he thought it was just a cramp. Then he tried to stand. The moment his foot touched the floor, his knee buckled. A sharp, grinding pain shot through the joint, stopping him cold. He grabbed the edge of the dresser, breathing through the wave of pain. When he finally steadied himself, he limped to the kitchen, the same slow shuffle he'd used on too many bad nights before. He opened the fridge and reached for what he always reached for, a cold, familiar soda. He believed it helped him relax. He believed it had nothing to do with his knees. But the next morning, when he described the flare-up, someone asked him one question, a question that would change everything. What if the worst thing you're doing to your knees is what you're drinking? Most people never think to look there, but today you will. Most people assume their knee pain comes from age, weight, or genetics. But more and more research shows that pain is just as much chemical as it is mechanical. Your bloodstream, your tendons, your inflammation levels, your uric acid levels. These things change your pain dramatically, and what you drink changes them. People picture arthritis as bone grinding on bone, but that is only part of the story. The reality is that the most intense knee pain comes from the tissues surrounding the joint, not the joint space alone. Let's break down the surprising forces inside your knee right now. First, inflammation. Inflammation compresses the joint space more than cartilage loss does. When inflammatory chemicals rise, tissues around the knee swell like a sponge filled with water. Imagine trying to bend your knee while someone is stuffing more and more padding inside the joint. More swelling means less room. Less room means more pressure. More pressure means more pain. Inflammation also excites nerve endings. These nerves become hypersensitive, interpreting even normal movement as painful. This is why some days your knee feels worse, even though you didn't do anything different. Second, tendon stiffening. Your tendons and ligaments are supposed to stretch and absorb shock, acting like natural springs for your joints. But when sugar levels stay high in the bloodstream, sugar molecules attach to tendon collagen. This forms something called advanced glycation end products, or AGES. AGES are tiny chemical crosslinks that make tissues stiff, brittle, and less elastic. Think of your tendons like bungee cords. When they're healthy, they stretch and recoil smoothly. But when AGES build up, it's like those cords dry out in the sun. They crack, resist movement, and pull harder on the joint. This tendon stiffening increases the load on your knee. It reduces the cushioning effect your tendons normally provide, leaving the joint to absorb more pressure by itself. It also limits your knee's range of motion, making stairs, bending, and standing feel heavier and more difficult. Third, uric acid crystals. Most people think gout affects only the big toe, but uric acid crystals can form in the knee as well. These crystals are microscopic, but they have sharp edges. Under a microscope, they look like slivers of glass or tiny needles. When they slip into a knee that is already irritated, they scrape the cartilage surface like sandpaper. This creates sudden flares of stabbing pain, a burning sensation, or the feeling that the knee is catching or locking. Uric acid spikes quickly after certain drinks, especially sugary sodas and alcohol. Even if your doctor has never diagnosed you with gout, you can still have microcrystals aggravating your knee. Fourth, cartilage wear. Cartilage thinning happens, but pain levels do not always match X-rays. Two people can have identical images, yet one feels mild discomfort while the other struggles to walk. That's because cartilage loss alone does not create severe pain. The pain level depends far more on inflammation, tendon stiffness, uric acid levels, and your overall metabolic chemistry. What you drink affects every one of these factors. Now, let's talk about the biggest offender, the drink that worsens inflammation, stiffens tendons, raises uric acid, and accelerates cartilage breakdown. Soda and every sugary drink made with high fructose corn syrup. High fructose corn syrup is around 45% glucose and 55% fructose. Fructose is handled differently by the body than regular sugar. It bypasses normal digestion and goes straight to the liver in large amounts. The liver treats it like a toxin and rapidly converts it to fat and inflammatory byproducts. These chemicals enter the bloodstream and travel directly to your joints. Research shows high fructose corn syrup raises interleukin-6, C-reactive protein, homocysteine, oxidative stress, and uric acid. It's the perfect storm for joint pain. But here's the part most people never hear. Sugary drinks don't just increase inflammation. They shut down the body's anti-inflammatory defenses. Your natural fire extinguishers drop sharply, leaving your joints unprotected. Healing slows. Tissue irritation lingers longer. Pain becomes more persistent. Sugary drinks also form AGEs. AGEs stiffen tendons, damage cartilage, and accelerate tissue aging. They make your joints biologically older than you really are. Even if you are 65 on paper, sugary drinks can make your knee tissues behave as if they are 75. High fructose corn syrup also raises uric acid faster than almost any other dietary source. Higher uric acid means a higher chance of razor-like crystals forming inside the knee. These crystals often go unnoticed until they trigger sudden sharp pain, swelling, or heat in the joint. There was even a clinical test comparing water, milk, and soda. Soda produced the highest inflammation, the highest oxidative stress, and the highest uric acid spike. If soda were a pill, it would require a warning label for joint pain. Now, let's talk about the second drink that quietly worsens knee pain: alcohol. Alcohol is known to dehydrate the body, and your joints depend on water. Cartilage is almost 80% water, and alcohol pulls that water out. Without proper hydration, cartilage becomes thinner, drier, and less able to cushion the knee. Alcohol also raises uric acid. This is why people often wake up after drinking with stiff, swollen, or burning joints. Alcohol damages the gut lining too. A weakened gut wall allows inflammatory molecules to leak into the bloodstream, a condition often referred to as leaky gut. When those molecules circulate, they aggravate knee tissues and increase systemic inflammation. Alcohol reduces absorption of nutrients like magnesium, omega-3 fats, and vitamin D, all of which are essential for maintaining healthy joints and lowering inflammation. And alcohol increases inflammation for 12 to 24 hours. If your knees hurt more after drinking, that's not coincidence. That's chemistry. Now let's talk about what to drink instead. Water. Increasing your water intake can thicken synovial fluid, the natural lubrication inside your knees, within 24 hours. This reduces friction and makes movement smoother. Green tea. Green tea contains EGCG, a powerful antioxidant shown to reduce cartilage breakdown, lower inflammatory markers, and even improve oxygenation to joint tissues. Turmeric with black pepper. Black pepper contains piperine, which increases curcumin absorption by up to 2,000%. Curcumin reduces inflammation and improves joint comfort. Unsweetened tart cherry juice. Studies show tart cherries lower C-reactive protein, an inflammation marker linked directly to joint pain. Some research suggests it may be as effective as certain anti-inflammatory medications. Low-sugar berry drinks. Berries are rich in polyphenols that help repair tissue stress and reduce inflammation. If you want more support, a few simple diet changes help as well. Add omega-3 fats like salmon, sardines, chia seeds, and walnuts. Reduce heavily processed seed oils that contribute to inflammation. Avoid processed meats, which create AGEs, and eat more fiber, which helps lower inflammation, regulate blood sugar, and reduce uric acid. Now here are the most common mistakes that keep knee pain stuck. Thinking arthritis pain is only about cartilage. Believing juice is healthy when it's really liquid sugar. Taking supplements but still drinking soda. Having just one sugary drink a day. Not realizing alcohol causes next-day stiffness. Ignoring how sugar stiffens tendons like old rubber bands. Your knees may be worn down, but your pain is not permanent. When you remove what inflames your joints and replace it with what supports them, your knees can change faster than you think. One drink removed, one drink replaced. 1 week your knees can feel. Your joints are not giving up. They're asking for a chance. Try 7 days without sugary drinks. Replace them with water, turmeric tea, or green tea. Pay attention to your stiffness, your steps, and your mornings. Your body will tell you the truth. If this video helped you, share it with someone who needs it. And for more insights like this, stay tuned to Health Report Live, where your health is always front and center.